On social samantha. Without further delay, I would like to call Dr. Muralidhar Sharma sir, STMCAOP, to take over the session. Welcome to you, sir.
We'll start with the next chapter. Krityakritya vidhim adhyayam vyakhyasyaamah yathovata bhagavan dhanvantarihi. Kritya and akritya. The literary meaning is something worth doing and not to be done. To be done or not to be done. Now this is about the prediction of prognosis. It's not that the patients who are categorized as akritya should not be treated, but rather they are asadhya, difficult to be treated. So it's a sort of a prognostication. Sushruta has given a lot of importance to prognostication of the disease. Before you start the treatment, you should know the limitations. That's the idea. तत्र वयस्थानां दृढानां प्राणवतां सत्त्ववताम् आत्मवतां च सुचिकित्साः व्रणाः एकस्मिन् वा पुरुषे यत्र एतद् गुणचतुष्टयं तस्य सुखसाधनीयतमाः तत्र वयस्थानां प्रत्यग्रधातुत्वात् आशो व्रणाः रोहन्ति दृढानां स्थिरबहुमांसत्वात् शस्त्रम् अवचार्यमाणं शिरास्नायुवादिविशेषान् न प्राप्नोति प्राणवतां वेदनाभिघात आहारयन्त्रणादिभिः न ग्लानिः उत्पद्यते सत्त्ववतां दारुणैरपि क्रियाविशेषैः न व्यथा भवति तस्मात् एतेषां सुखसाधनीयतमाः. Now, prediction of the prognosis is based on different aspects of the disease. The first one is about the status of the body of the patient. Then, of course, in case of the wound, you will have many more these levels of assessment. We will come to that part. The first is assessment of the patient's condition. The conditions which are favorable for healing of a wound would be a young age, relatively young age. In young age, because the tissues have a higher potency for growth, the tissues are healthy and they have a higher potency for the growth, the wounds will heal faster. Then those who have physical strength, dridhana, physically strong, because their body is having a well-defined anatomy, during surgery or during handling of the tissue, chances of complications due to collateral injury to the other organs will be lesser. This is somewhat bit questionable, but anyway, in a practical situation, it's true that if you have all the organs, muscles, and others are well defined, the chances of collateral injury are lesser. But during surgery, whether the muscles are developed or not, you need to take care of the other injuries as such. Pranavatam, now, those who have a tolerance to pain, tolerance would be prana is Shakti Yuktanam. According to the commentary, the prana is considered as a Shakti Yuktam, or the another commentary says Atmavadam पुनर्मिताहारादि विहारादिभिः उपदेशैः न अन्यथा मति प्रवर्तते. Because they can tolerate or they can bear with the restrictions about the diet and exercise better, there again the chances of complications would be lesser. Chances of complications due to the pain and the chances of complications or troubles due to the restrictions about the food and so on, they would be lesser. They would tolerate them better. Then sattva means willpower. Those who have a better willpower, dharunaihi api kriya visheshe vyatha bhavati. They have a better pain tolerance and hence they can tolerate the crux of the treatment better. त एव विपरीतगुणाः वृद्धकृश अल्पप्राणभीरुषु द्रष्टव्याः. The opposite to that, like old age patients and emaciated patients, those who have lesser willpower, the prognosis is poor. So that's one way of predicting the prognosis. Another way of predicting the prognosis in case of the wound is the location, anatomical locations of the wound also is another factor by which you can predict the prognosis. The areas having more of fat tissue and those areas of the body which have more movement, more flexible and more movement, and those areas of the body where the sensory sensitive organs are located, and those which are close to the vital viscera, these are the areas where the wounds can lead to complications. And those areas are spik, payu, prajanana, lalata, ganda, osta, pristha, karna, falakosha, उदर जत्रु मुख आभ्यंतर संस्थाः सुखरूपणीयाः व्रणाः. The wounds in the areas like buttocks or around the genital area and in the facial area and in the back, and around the scrotum, these are, and neck also, the wound would be comparatively healing better because these are the areas where the vascularity is more. Comparatively, the fat tissue is lesser and blood flow is more. And the areas like Akshi, Danta, Nasa, Apanga, Strota, Nabhi, Jatara, Sevani, Nitamba, Pashwa, Kukshu, Vokshak, Kaksha, Spanasandhi Bhagagataha, Sapena, Puya Rakta, Anila Vahino, Antashyalyashtadushikitsyaha. The wounds which are located close to the eyes, teeth, nose, and the ears are, because these are the sensitive organs and minor injury can result in more complications. Over the abdominal wall and in the perineal area and the lower portion of the buttocks, uh, lumbar area and back also, and over the chest. In these areas, very specifically, if there is a huge amount of pus or even there is a movement of the gas. Now, movement of the gas in a wound can occur due to two reasons. One, it could be due to the gas gangrene, septic conditions where the gas could be produced, or if the wound is connected to any visceral organs like intestines, then the gas may flow. So both these conditions, they make the condition difficult to be treated. ಅಂತಃಶಲ್ಯಾಶ್ಚ then adhobhagashcha urdhvabhaga nirvahinah, a wound which is located in the deep lower surface, but the collection is on the superior surface, or the opening is on the superior surface, and there is a tendency for the collection of the pus in the other area that results in improper drainage, and hence that also is comparatively incurable or difficult to be treated. Romanta upanaka marma janghasya samshitaha, those wounds which are very close to the hair follicles, the folliculitis-like conditions, because there again you have a membrane which prevents the drugs to reach to the area. In folliculitis, the condition is difficult to be treated. Upanaka, the nail bed, again nail bed would have a relatively less vascular tissues and hence and more sensitive area. And marma, of course, any of the marma where you have multiple organs located. Janghasti samshidaha, in the lower limb, in the shin of the leg. Again, that you have a lesser fat and the skin is just over the bone. And because the skin is more stretched, there again the wounds will heal lesser. Bhagandaramappi cha antarmukham sevani kotakasti samshidam, fistulae which are having only internal opening but no external opening, or those fistulae which are connected to the pelvic bones, they are difficult to be treated. Now, the prediction of the prognosis also is based upon presence of the other diseases, the other systemic diseases which can make the prognosis poor. So that's the next level of the assessment. So the first level of the assessment is the physical condition, status of the patient's body. The next is about the location. The next is whether the patient has any other disease or not. And among those disease conditions, kustinam, vishajustanam, shoshinam, madhumehinam, vranaha kachana siddhanti yeshan chapi vranaya vranaha. Those who have skin diseases and where there is a poisonous contamination, and those who have emaciation, cachexia, and madhumeha, prameha conditions, madhumeha particularly, where vajra prameha, where the healing would be very poor. These are the conditions where the wound will heal lesser. Of course, we may add many more diseases to that. Then the next is about the type of the disease, where diagnosis that makes the prognosis poor would be avapatika, niruddha prakasha, saniruddha guda, jataradi. The diseases like the balanitis and the phimosis and the imperforate anus or rectal strictures, because these are the areas where there is a sensitive organ and there is a chance of contamination. And granthi kshatrakrameha pratishayadaha, if there is a maggot formation after the pratishaya, after the nasal inflammation, so, of course, to have a maggot in the nasal wound is most commonly suggestive of a malignant change in practice as such. Kostajasya tvakdoshinam pramehinam ye parikshadeshu drishyante, or similarly, kshatakrimeha, that maggot formation in Diseases related to the abdomen or in the patients with the Prognosis, that's the skin disorders in patients of Prameha, if there is maggot formation that makes the prognosis poor. शर्करा सिगतामेह वातकुंडलिका स्थिल दंतशर्करा उपकुश कंठशालुकम निष्कवोषण दूषिताष्ट दंतवेष्टाः विसर्प अस्थिक्षत उरक्षत व्रणग्रंथि प्रभृतयश्चयाप्याः. The diseases of the Sharkara Meha, crystal area, or the patients with this, Sikata Meha also is a crystal area. The difference between Sikata Meha and the Sharkara Meha is a Sharkara is a Ashmadi Bhinamurti Saiva Vapena. If a stone is formed and then stone gets broken up, then it's the Sharkara Meha. Without having a stone and the crystals are formed, then it's a Sikata Meha. So that's all the final difference. From the contemporary science point of view, don't make that difference. Any condition is called as a crystallia. Then Vata Kundalika, where there is a obstruction to the lower portion of the intestine, are Astila prosthetic pathologies. Danta Sharkara, the tartar in the tooth or the dental enamel is having affected, like Upakushaha, the pyuria or gums being infected. Kantashalukam, a swelling in the neck, possibly like tonsillitis. Then Nishkoshana Dushitashta Dantavestaha, the gums which have become atrophied, and then Visarpa, the septic, like cellulitis like conditions, Astikshata bone injuries, or osteomyelitis like condition, Urakshata chest injuries, Vrana Granthi, where there is a hypertrophy of the wound healing, that also are considered either Yapya or Asadhya. Yapya, where treatment may not get cured. साध्याः इव याप्यत्वम् आयान्ति याप्याश्च असाध्यतां तथा घ्नन्ति प्राणान् असाध्यस्तु नराणाम् अक्रियावताम्. If the treatment is not proper, a sadhya prana can become yapya, or yapya can become asadhya, and asadhya can become fatal. यापनीयं विजानीयात् क्रिया धारयतेति यं क्रियायां तु निवृत्तायां सद्य एव विनश्यति. प्राप्ता क्रियां धारयति याप्य व्याधितमातरं Prapadishadivaagaram Vishkambhasadhyojitah. So Shruta explains what is Yapya in this context. And the Yapya is a disease where only the treatment can sustain the patient. If the treatment is interrupted or if the treatment is not given properly, then it can result in a fatal complication. And so Shruta gives a comparison similar to a house falling down but and supported by some extra poles. That's how it's given. Of course, that's a very nice description. The next part is about prediction of the prognosis by appearance of the wounds, like how they look, and which are by which you can predict the complications of improper healing. Now, in the context of Dushtavrana is described earlier, the features of the Dushtavrana. And most of these features which are described are again repetition of the Dushtavrana features, but explained in a different manner, where it's a clinical observation. Have you, as you look at the wound, as the changes would are seen, you may predict about the prognosis. And those are Mansapindavadu Udgataha, when there is a surface is elevated and looks like a fleshy body, which is a suggestion of a hypergranulation. Prasekinaha, those which have persistent discharge, as in case of a venous stagnation wounds, there will be continuous watery discharge. Antarpuya Vedanantaha, where there is a collection of the pus inside, deep collection of the pus inside, any deep-seated abscess conditions. Ashwapanavat Udurtavostaha, where the edge of the wound is raised up, looking like the rectum of a horse. That's the elevated edges which tend to occur, suggestive of the neoplastic changes, or even hyperkeratinization can result in the same. Katinaha, where the wound surface has become hardened due to fibrosis, less vascular or avascular wounds as such, or Goshrungavata Uddhata Mridumamsa Pralohaha, where the surface is elevated with the polyp-like appearance, which is suggestive of more chances of malignancy as such. Now, Sushruta has given two descriptions, Mamsapindavata Udgataha, Goshrungavata Udgataha. Mamsapindavata, where there is a fleshy mass, uniform, and Goshrunga, where it's a polyp-like. Now, if you come across these kinds of wounds, where a wound has a more polyp-like, small, finer projection, chances of malignancy is very high. whereas a hypergranulation produced otherwise, where it's a less chance of neoplastic, would be the surface would be somewhat global or roundish like. So Mamsapindavad and Goshrungavad. This kind of the two descriptions suggest about a fine clinical approach or clinical assessment. Then Dustaruchila Sravinaha, Tanushita Pichila Asravinasta, where there is a serious discharge, the wound also is suggestive of poor prognosis. Serous discharge again is suggestive of a improper circulation, where vascularity being not so healthy. Madhya Unnataha, where the middle of the wound is highly raised, and this is suggestive of a hidden foreign body. It's also a hypergranulation. So, from the current point of view, you name it as hypergranulation, but it's not only hypergranulation. It's a possibility that there could be a hidden foreign body, and these kinds of wounds need to be explored, where in the middle you have a raised surface. Then Avasana Shushila Paryanta, if there is a depression and there is a connected cavity, which is a consequence of a hidden foreign body. A hidden foreign body inside may be a source of irritation. I would not say foreign body, a source of irritation in a wound which is present in the deeper plane can result in either a hypergranulation where the middle of the area, the center of the area has the maximum hypergranulation area, or it can result in a granular changes and a cavitation or a tract formation, and that tract has to be explored to locate the source of irritation. So both these are signs of a hidden or deep-seated source of irritation. Then Shadathula of the Snaijalvantaha, when the surface shows the tendons and others, like as you see in the patients of 205 now, where the tendons and ligaments are seen, that's also suggestive of a poor prognosis. Then Vasamedo Madhya Mastulanga Sravinaha, when the marrow or the brain tissue is leaking through in either in osteomyelitis or in head injury conditions, where the deeper contents are flowing through, quite obviously they are difficult to be treated. Now those are the conditions where the prognosis is poor. Then in addition to this, so she says, Pita Asita Mutra Purisha Vatavahinashta Kostastaha, the wounds which have connected to which have a connection to the visceral structures, which result in flow of either urine or maybe fecal material or the flatus material, which are suggestive of a wound connecting to the viscera, and particularly if there is a distal obstruction, then the contents will be leaking through, which we call as a fecal fistulae. तयेव उभयतो भाग व्रणमुखेषु पुयरक्तनिर्वाहिनः क्षीणमांसनाञ्च. Those wounds which have both the openings, two openings, sinuses with two openings, and both the openings are discharging light. So, of course, if it's simply two openings, it may not be suggestive of more issues, but having multiple tracks, having more than one opening suggests about, again, a possibility of a hidden source of irritation, very frequent occurring in chronic osteomyelitis. Sarvotokateshta Anumukaha Mamsakududavantaha, if there are very huge number of openings, multiple and large number of openings, and openings are quite small and constricted, which is more frequently seen in case of tubercular ulcers. Tubercular ulcers will have that kind of features. So in Sashabda Vatavahinascha Shirakkantastaha, the wounds which allow for flow or which will be allowing the gaseous substances flow with sound in and located in neck or the head area. That's again having a connection to the respiratory system, a connection, open wound connected to the either the trachea or any other part of the respiratory tract as such. Kshinamamsanam puyarakta nirvahinah arotaka avipaka kasa shwasa upadravaयुक्ताः. Then the wounds which result in emaciation and the wounds which result in gastrointestinal tract as well as respiratory complications. Now, the gastrointestinal tract complications and the pus formation, they are suggestive of an acute inflammation or septicemia. Then Kasashwasa, respiratory complications in a patient of wound is quite commonly produced due to embolism. So wounds can be a cause for the embolism if they are deep-seated, and a infective embolism can occur in any patient of wound. So any patient of wound being treated, you have to be careful. Not that every patient would have that complication, but if a patient complains of respiratory complaints in a patient of wound, you have to be careful. Then Bhineva Shirakapale Yatra Mastulunga Darshanam Tridoshalinga Pragubhavaha Kasashwasova Yasyati. if there is a head injury and the brain tissue is leaking through a open head injury where the intracranial substances are leaking through, that makes the prognosis poor. Then again, the same thing is repeated. Vasam medothamajana mastulungam jayasraveda agantusturana siddhyet na siddhyet dosha sambhavaha. The wounds which leak the contents like the vasa meda, that's the deeper fat tissue or majja, bone marrow, or even the brain tissue is leaking through. If it is a traumatic wound, it may heal. So she says it may heal, but if it's a dosha sambhava, if it is spontaneously generated, then it will not heal because it's a sign of a infection. A infected wound in that condition impossible to be treated. It's absolutely true even now. But a non-contaminated fresh wound may heal now in the present day situation. अमन्मोपहिते देशे शिरा सन्ध्यस्य वर्जिते विकारो यो अनुपदीयति तदसाध्यस्य लक्षणम्. Even if the wound is located in a otherwise uncomplicated location, amarma area, and still it doesn't heal within the expected period of healing. The expected period of healing is 1 week for primary healing, 3 weeks for secondary healing. If that doesn't occur, if the wound, even after proper treatment, and even if otherwise the prognosis can be predicted to be better, and if the wound doesn't respond to the treatment, then you have something missing, and Sushil says that also could be a sign of a poor prognosis. क्रमेण उपजयं प्राप्य धातून् अनुवदर्शनैः न शक्य उन्मूलयितुं वृद्ध वृक्ष युवामयः सस्थिरत्वात् महत्त्वात् च धातु अनुक्रमेण च निहन्ति औषधबीजानि मन्त्रान् दुष्टग्रहो यथा. Now, certain of the wounds may apparently heal temporarily, but later on they may recur. Now, they may recur because the healing tissue was not healthy, or there was some source of inflammation left over in the area, and this kind of a recurrent wound will be again producing more complications. A wound which has having a improper healing and there is a tendency for recurrence or dehiscing in due course of time, it can result in more serious complications. And Sushila gives a simile to a tree with lots of deep-seated roots. A tree with the deep-seated roots will be difficult to be removed out or lifted out. So similarly, because the wounds have become chronic and temporarily the tissue or that source of inflammation is hidden inside and it's covered by fibrous tissue, it will be difficult to be treated, and all the ocean area, the medicines cannot reach to the area. This is absolutely true. There will be fibrosis, and fibrosis prevents any of the substances to reach to, and in that condition, a curating is absolutely necessary. And Sushila has used another word, dhatu anukramana. Dhatu anukramana is where a dhatu vitiated will result in production of the further dhatu. Now, this is exactly how the malignancy would occur. I will come to that part at the end of this session. There is a significant similarity between the process of wound healing, the tissue regeneration during the wound healing, and the tumor pathology. And if there is slight missing, a wound healing can result in the tumor pathology. Dhatu anukramana word also is seen in case of the Arbuda Vyadhi as such, Asadhya Vyadhi, where there is a similarity. So that similarity of a tissue, vitiated tissue, producing more and more of vitiated tissue is the dhatu anukramana, which is the exact definition of the neoplastic growth. Now, ato yo viparitasya sukhasadya sauchite abadhamulakshupako yadudutpadane sukha. Wounds which do not have these kinds of complications, they are relatively easy to be treated, and it gives a simile to a small plant without much of a root as such. Now, I said about that comparison of the tumor pathology and the wound healing. See, in the wound healing, once the wound occurs, there has to be an increased growth of the tissue, and that increased growth of the tissue is produced due to a signal, proliferative signal. See, there has to be a proliferative signal, and the tissue has to get grown. And once the wound healing has completed, the surface has completed, that would stop in wound healing. That wound healing that wound promoting inflammation would stop further, and there will be no more healing as such. When it comes to the question of tumor, In the tumor too, the whatever the real factors which regulate the which initiate the tumor, once the tumor growth starts, it again starts with the similar issue of sustaining proliferate signaling. There will be the similar issue. The tissues will grow, start multiplying. The only difference is that multiplication process continues and it resists the cell death. There is no question of remodification, and this continues infinitely. And those factors which stop the process further, they do not exist in cancer. So that's all the difference. So there is a significant similarity between the course of the disease of malignancy and the wound healing. The only the difference is wound healing is controlled where there is an end to that, whereas in a cancer there is no end to the growth. So it's a process starts and then process continues, no break as such. So that's the difference, and because of that, a wound which hasn't healed properly within the shorter within that expected duration can become malignant. Dhatu anukramana is a complication. Now, Sushil gives you the features of wounds at different stages of healing. Now, once the healing process has occurred, then you are having a definite sign of the healing. That kind of wound is called as a Shuddha Vrana. Dushta Vrana we have described earlier. Now, opposite to the Dushta Vrana is a Shuddha Vrana. And or maybe opposite to the Shuddha is a Dushta, not Ashuddha. So many times students commit that kind of an error. So it's not Ashuddha Vrana, Dushta Vrana and the Shuddha Vrana. And the features of the Shuddha Vrana are Tribhis Doshehi Anakrantaha, Shyamustha Pidaki Samaha, Avedanaha, Nirasravaha, Vrana Shuddhaiva Tyade. Now, once it has become now definite that all the inhibitory factors have been stopped and the wound is certain to get healing, and you have a proper granulation tissue growing, the granulation tissue is in the proper direction and having that uniform features, then in that condition there will be no signs of any dosha involvement. The color will be quite healthy, reddish healthy color, and the edges of the wound will have a somewhat bluish tinge due to the granulation tissue which have matured. The mature granulation tissue will have a bluish surrounding area, and the surface would have very small granular appearance, minute granular appearance, which is suggestive of again a healthy granulation tissue. And this is named by Sushil as a pidaki, small pidaki. And avedana nirasraha, pain will be lesser, and there will be not much of a discharge. Now, just before that healing, the process, there is a tendency for the healing, but it's not yet established healing. That condition is called as Rohat Vrana or Rukhyamana Vrana. And in that condition, Kapotovarna Pratimaha Yasyantaha Kledavartitaha Stiraha Chipitika Vanda Rohatiti Tamadisheta. Rukhyamana Vrana is just one step earlier to that of a Shuddha Vrana, where the surface would be having a granulation tissue which is not yet uniform, and these are called as chipitika. So pidaki and chipitika. Pidaki is the minute granulation tissue seen in a healthy wound. The chipitica are the budding granulation tissue where they have not yet shown the sign of maturation. But of course, at some areas there is some portion of maturation, and hence the color will be kapotorna, not that healthy color, somewhat grayish color, which is suggestive of a early stage of healing, and there will be lesser discharge. So most important factor which decides about the phase of healing in this is the color of the wound. Color would be changing. Now this is a very important observation. The gradual color changing during the course of wound healing. Then once the wound has healed, the evidence of the healed wound is Rudavatmanam, Agranthim, Ashunam, Arujam Ranam, Tvaksavaranam Samatalam Samyak Rudham Vinirtisheta. A wound which has healed would have a completely covered surface, and there will be no mass or no swelling at the area and no pain. Color of the wound would be exactly the same color as that of the skin surround the area. Surface will be uniform. That's the issue. Now, the color changes in the wound is a very important observation even now. Even in the contemporary science, observation of the color changes is a very important factor to decide about the status of the wound healing. And there is a standard color chart given suggestive of the different stages of the wound. If the wound has necrotic tissue, it will be having a blackish color. If there is a slight scuff but not necrotic, it will be yellowish color. Then gradually it becomes reddish once the granulation has started, and then you will have a healthy pink color suggestive of epithelialization, which is the color of the Shuddha Vrana and Rushyamana Vrana. Here these are the Dushta Vrana conditions. If you observe the patient in 205, now the color, when he came over here in the beginning, it was blackish in color. Now at present the color is a yellowish, that's a slough color tissue. Gradually, if the patient progresses well, gradually you may expect these color changes as such. So color changes in a wound would be a guideline to decide whether the wound is in the proper track or not. Now, these days, that observation of the color changes need not be limited only by your visual observation. Lots of these tools are available, softwares are available, which can use the which can give you a better idea about the color as such. And there are easily available smartphone tools to assess the size and color of the wound. There are many. One which I have tried is and which I found convenient is a imitomeasure, and I think some PG theses have been written using this asset. So that's about the wound healing and the color observation. The last part is dosha prakopad vyayamat abhigatat ajirnatah harshat krodhat dayadvapi vrano rudopi diyate. A wound which has healed in due course of time can recur if you do not take care of the precautions. And those conditions, those factors which can lead to a recurrence of a healed wound could be dosha prakopat, if there is a vitiation of dosha, or if there is a rigorous exercise, or due to trauma, or even ajirna, or emotional disturbances can result in a recurrence of the wound. With this, we close this chapter. Iti Sushrutamikayam Sutrasthane krityakritya Vijay Nama Trayovimshodhyayah. Clinical assessment of the wound and prognostication need extensive observation and experience. Course of the wound may be affected by the general health status of the patient, and it is crucial to take care of those factors to achieve good healing. With this, we will wind up today, and if there are any questions, we will try to answer. Mm. A tracheostomy wound is difficult to heal. Yes, of course. When they say tracheostomy, when it is done surgically with a specific purpose, you do not have these issues. But if there is a wound which has connected to the trachea and there is a wound, a leaking wound, air leaking through the wound, definitely the prognosis is poor. In tracheostomy, that surgical protocol, we make use of a tube to allow the air to flow through, and it is done with a specific purpose. And after a certain period of time, once you remove this tracheostomy tube, the wound will heal spontaneously, provided there is no distal obstruction. If there is a distal obstruction, then the tracheostomy wound would not heal. So that's about the factors which make the wound to heal in a tracheostomy. I think that's a sufficient answer. Right. Any more questions? There are no more questions, so we'll wind up. Okay, thank you.